All right, so today we're going to go through the simplification of the patient journey. It's critical to understand this simplification based off of the other video, which shows the technical components so you can understand the vehicles that get us there. But now we're going to show a secondary version of this, which really brings it to fruition for a patient journey. So in the beginning, we have patients who are somewhat disaffected, maybe doing some self-diagnosis, maybe looking online, may not even know what they can do or have some sort of inclination. There is also secondary cases, third cases out there that have been floating around. There's all sorts of different variants, but they're not happy, and they don't necessarily have a direction yet. And that's when your first piece of content comes in. So our first piece of content, again, makes them aware of the solution, makes them aware of other information, but we've not got them through the process of becoming more involved with the practice. Again, so this is the first Facebook, Google, Twitter, Instagram, email. We're starting to get the patient engaged at some level. So our next step is the engagement. So we're then following up with a secondary piece of content, and usually that's a video. We find the video works the best, and we're usually engaging them in Facebook and or in Google to get them to the next page of the stage. But this engagement really starts to begin to warm the customer up. So they begin to know a little bit more about the practice. They learn a little bit more. The branding is more there. So the next level, again, is the same process, which is that we're going to be pushing more content to them based off of, again, the process that we use to segment the population and segment the people into the right buckets. And we get them to then take a conversion step. And the first conversion step is usually a guide book or another video that is a procedure video or a valued piece of content that they're willing to give their email for. At this point, you've begun to get trust. So we've gone from sort of beginning stages, someone in a condition, to engagement, to then email conversion. Once we have their email, we then can follow them up with specific language dedicated towards their particular case or their predicament. And we want to follow up these process steps by continually asking for the appointment. And this whole process then is, again, through either email or through Facebook with retargeting. We continue to bring more value, and more value after we've got the email conversion. And we finally get to the next stage, which is the appointment. So this is the first time we're actually transacting activity with the patient. When we're at the appointment stage, we have a client who's necessarily now trusted us to the point where we're physically face-to-face, and we've gotten through the next stage, which is that you're starting the process to make them convert to a procedure. And this is really the most critical step, is that we have to follow this from the appointment stage. We have to continue to bring on more valued pieces of content. So we bring the same process we started, which is that we're using the different tools. We're still engaging with the patient. We're really getting them excited because they can see that we're providing more and more value to them on a consistent basis. This is email, Facebook, Google, Twitter listening, Instagram, email, videos. All of these things continue to arrive so that we don't lose the patient from the initial appointment, and our conversion rates go even higher. So as we get the patient even more aware, hyper aware that we're the right solution, you're the right solution, we then go to the procedure standpoint. So now that you've got them converted as a patient and into a procedure, we then take them to the next step, which is that we've got a review process. Now, the key here is once that they've gotten through the procedure, we've gotten proof positive that the results and the outcomes are a great solution. We want to immediately get them into the queue and get an email out to them that, and even a text message to get them to review into the standard Google, Yelp, Health Grades, and if we can, even some of the more higher level directories. Sometimes we can get some of the specific directories that might be to a practice environment, which is specific to that particular genre of practices, and then advocate. So this is where the patient journey is really key, is that we get them to share their experience, right, by getting a video testimonial, and then that goes right back into the engage process with showing happy patients that have got great outcomes. So this is the patient journey in a simple form, and if you can think about it as the steps here, which is make them aware, engage them, get their email. As soon as they get the appointment, re-engage them with great content, get them excited, bring them through the procedure, get the review, and then ask for a video testimonial, and then use that again back to the engagement process. This is how the patient journey works. And the other video goes through the technical aspects of this, but this is really the solve for bringing consistency into the patient journey.